Good morning. Today I'll be talking about atraumatic restorative treatment in children. So, atraumatic restorative treatment is also known as alternate restorative treatment. It's a procedure based on removing carious tooth tissues using hand instruments alone and restoring the cavity with an adhesive restorative material. Now, one of the main questions that can be asked in ART is the principle of ART. The two main principles of ART are removing the carious lesions using hand instruments and also restoring the cavity with a restorative material that sticks to the tooth. Currently, ART is performed using glass ionomer as a restorative treatment. ART was initially developed in Tanzania in mid 1980s as a part of community-based primary oral health program. The ART approach is based on a minimal intervention and maximal prevention retaining the sound tissues. Here, the photo shows the official adoption of ART by WHO at Oral Health Day at 1994. The advantages of ART include easily available, inexpensive hand instruments. As it is almost a painless procedure, the need for local anesthesia is eliminated or minimized. It involves the removal of only decalcified tooth tissues, conserves the sound tooth tissue as much as possible. Sound tooth tissue need not be cut for retention of filling material, chemical adhesion of glass ionomer restorative material with cavity walls. Simple infection control is used without the need to use autoclaved hand pieces. The leaching of fluoride from glass ionomer probably remineralizes the sterile demineralized dentine and prevent development of secondary caries combined with preventive and curative treatment in one appointment. Repairing of defects in the restoration can easily be done and it is less expensive and less time consuming. One sitting, several fillings can be done. It enables to oral health workers to reach people who otherwise never would have received any oral health service. Now, if it is so advantageous, why are we not using it extensively? Because of some of the disadvantages of ART. What are the disadvantages? ART restorations are not long lasting. One of the most important disadvantage of ART is that it is not that long lasting. Average life is only 2 years. As fundamental principles of cavity preparations are not followed, all health workers may not accept it. Use limited to small and medium sized one surface cavity only. Low wear resistance and low strength of the existing glass ionomer materials, and also because of the hand fatigue, it is very strenuous for the doctors, and a relatively unstandardized mix of glass ionomer may be produced due to hand mixing. The reasons for using hand instrument rather electric driven hand speeds is that makes care accessible to all and biological approach which conserves the tooth, low cost, pain limitation, simplified infection control. The reasons for using glass ionomer that can be asked as another short note for ART is that glass ionomer chemically bonds to both enamel and dentine and need to cut the sound tissue to prepare the cavity is reduced. Fluoride is released from the restoration to prevent secondary caries. Glass ionomer is biocompatible, that is, coefficient of thermal expansion is similar to the tooth structure. Indication is that in small and shallow cavities that are accessible to hand instruments, introducing oral care to young children that is not previously exposed to dentists, sometimes patients with severe fear and anxiety, and for the homebound elderly, that is for the geriatric patients and those living in nursing homes. And of course, those who in high risk caries as an intermediate treatment to stabilize conditions. Contraindications include presence of swelling, abscess, or fistula, the pulp exposed to tooth, and the teeth have painful for a long time, and there may be chronic inflammation of the pulp. There is obvious caries cavity, but the opening is inaccessible to hand instruments. Steps include arranging a good working environment in and outside the mouth, select and use the correct instruments, controlling cross inspection, and use of glass ionomer material. The position of operators, work position, and position should provide best view. These are the arrangements that should be taken in and outside the mouth. Operator and patient should be comfortable, and operator position sets a straight back on a stool with feet flat on the floor, with stool adjusted required to see area clearly, and 10 o'clock to 1 o'clock positions, and 12 and 10 are the most commonly used positions. When working alone, a small table at the head of the end of patient or right side of the operator. Assistance, of course, oral health care as a team is more efficient. May not be possible in all settings. Train a person to mix cement and hand to the instruments. Assistant works at the left side of the operator and does not change position. Sit as close to patient as possible, facing the patient's mouth. Head should be 10 to 15 centimeters higher than the operator. A flat, stable surface to keep instruments. And the patient position include correct position is important. Table or bed with rubber or foam ring to support head. Head position so that saliva collects at the back of the oral cavity. Various head positions, tilting down, turning head, and right and mouth opening. These are some of the instruments and material used. The mouth mirror, that is used for reflecting light in direct view, to track the cheek or tongue, and explorer to, of course, identify the soft caries dentine. A pair of tweezers to carry the cotton wool, rolls, pellets, wedges, and articulating paper. Spoon excavator used for removing soft caries lesions, that is small, which is diameter is about 1 mm, and medium, that is diameter about 1.5 mm. Dental hatchet, that is used for widening the entrance to the cavity. Very important instrument when it comes to ART. Applied or carver, used for inserting the mixed GIC into cavity, and also the important aspect is to remove excessive restorative materials. Mixing pad and spatula, that's including for mixing GICs. Operating light, the light source can be natural or artificial. Artificial light more reliable, constant, and can also be focused on a particular spot. In a fielding setting, in a portable light source is recommended. Essential materials of ART include cotton wools, cotton wool pellets, petroleum jelly, and plastic strip again, and of course wedges and GIC. So the procedures for atraumatic restorative treatment, that is, first the tooth is isolated with cotton rules. Tooth suffers to be treated as cleaned with a wet cotton pellet. The entrance of the lesion is slightly widened by the hand instrument to remove all gross overhanging unsupported enamel rods. The dental caries is removed by using either the small or medium-sized spoon excavator. If necessary, provide pulpal protection by calcium hydroxide paste. The cavity surface along with the occlusal margins are cleaned. The cavity is acid etched. According to manufacturer's instructions, the glass ionomer cement is mixed. The mixed glass ionomer cement is inserted into the cavity and slightly overfilled. A gloved finger, which is smeared with petroleum jelly, is pressed on top of the entire occlusal surface and slight pressure is applied. The bite is checked, excess material is removed with a sharp carver. The bite is rechecked and all high points are removed. And the filling is covered with petroleum jelly once again, or the varnish may be applied. The patient is instructed not to bite with the tooth for at least half an hour. These are the procedural photos that are used for ART. With this, we come to the end of ART or atraumatic restorative treatment chapter. And the important aspect about this chapter is the indications, contraindications, advantages, and disadvantages. Thank you.